Today, Dr. Tom Nelson is going to teach us about treatment of canine heartworm disease. Dr. Nelson is the medical director at the Animal Medical Centers of Northeast Alabama, which is based in Anniston, Alabama. He has served on the AHS board since 2001 in many capacities, including president, past president, director, and program chair. In 2019, he was named to research chair, and he continues to serve in that capacity today. Welcome, Dr. Nelson.
Thank you. Happy to be here. Well, I'm going to talk about treatment strategies, and I know we only have about 20 minutes or so, so I'm going to try to cram 25 years of development of protocols into 20 minutes. One thing that you tend to talk about are the different stages of heartworms. And the stages are based on clinical signs, but it's not always necessarily based on how many worms are in there, what's going on, because you can have a class 1 dog who basically has mild disease, has massive amounts of worms, and it's not always a good prediction of how well they're going to respond to treatment. So when we develop our protocols, we're basically considering that worst case scenario, what could happen if you have a major reaction, what can happen if you have a massive amounts of worms, because there's really no good way to determine how many worms are in a dog. One, you could have a lot of immature worms which are not yet producing antigen, and therefore have a very low reactivity on your test, or you could have a worm that recently died and have a really great reaction, but still only have a few number of worms. So it's good. It's not a good prediction, but still we do know that class 3 dogs that are having severe disease, or even class 4s, are at a greater risk of having issues and complications from treatment. So we start looking at what the pathogenesis of heartworm disease is. And anytime you have these worms, and these things are basically 12 to 14 inches, 17 inches long in the pulmonary artery, they're going to cause inflammation. They're going to cause an arteritis. And they're also going to cause a pneumonitis, because the body is reacting to cytokines that are being released by the worms. And so you're getting these cellular infiltrates into the lungs. And we start talking about right-sided heart failure. And a lot of people think right-sided heart failure occurs because you have a massive amounts of worms that are just blocking blood flow, where actually the reason we're getting right-sided heart failure is because more is at the capillary level. You're getting lots of inflammation, then you're getting scarring, and that's causing increased vascular resistance, and that leads to the right-sided heart failure. So it's more likely a result of lung disease than it is actually heart disease. The heart disease is secondary to the lung disease. So that's basically what our mechanism is. It's because these worms are causing inflammatory response. They're causing swelling in the uvula. Those little things rupture, especially in an active dog. And then we're getting fibrosis and scarring, which is leading to that increased vascular resistance. We also know that live worms are a problem. They cause inflammation, but the biggest problem are dead worms. Dogs can tolerate live worms quite well if they're a relatively inactive dog, because worms produce a protein secreted from their cuticle that are able to hide themselves from the immune system, which once they're no longer alive and they're no longer producing those proteins, then you have all these foreign proteins, materials, dead worm products that are being released and causing severe amounts of inflammation, and that leads to most of our disease. And then there's also what we call the host-parasite relationship. Every animal is going to react differently to a parasite. Heartworms don't want to kill the host. They're relying on the host to be able to survive, so they're wanting to do their best not to kill the host. But again, like I say, when the worm dies, then we have these issues occur. So our classic patient, when we talk about a dog that has heartworms, is usually, and it's a heartworm disease, where you come in, they're coughing, maybe struggling for breath, maybe having ascites from right-sided heart failure. This is typically an active middle-aged dog. Heartworms lived around 5 to 7 years. So this is a dog that was infected when it was young. You're at a point where the worms are starting to die. The dog's active, and the assertion we're trying to pump blood through diseased vessels, and that leads to most of our clinical signs. So treatment principles. This is our goal. Our goal is to eliminate all adult heartworms with minimal post-treatment complications. If we could eliminate the worms and we have severe complications, that's not good. It's also not good to eliminate, get rid of all the worms. We need to be sure to get rid of all stages with minimal complications. So we talk about treatment versus management. Treatment sometimes is just trying to eliminate worms, where sometimes we have to manage a heartworm case. If we have a dog that comes in that's had some severe clinical signs, is coughing, lungs are very, very raspy, your radiograph shows, you have lots of disease going on. Typically that dog has had a worm that's recently died. And the last thing we need to do in that dog is to kill more worms. We need to get the inflammation under control and manage this case before it's ready to go ahead and do more treatment to kill more worms. So I got to say, dead worms cause more problem than live worms. The activity level is the single most important factor determining severity of disease. Dogs that have heartworms that are basically couch potatoes and never run around can tolerate heartworms quite well. But in an active dog that's very, very active, trying to pump blood through diseased vessels, this is when we get into issues with our thromboembolisms from these things rupturing. A couple good studies that were done. Ray Dillon years ago was trying to look at what the effect of number of worms were on vascular resistance. And so they had transplanted worms, about 14 in one group of dogs and 50 in another group of dogs. And then he was doing ultrasound looking at vascular resistance. And he actually found that the dogs with 14 worms had more pulmonary vascular resistance than dogs with 50 worms. Turns out that the technician who was taking care of the dogs with 14 worms felt bad for them and was taking them for a walk every single day, whereas the dogs with 50 worms were kept in kennels and not moving around. So again, activity is the single most important. This work was also repeated and shown again a few years later, that exercise is the biggest effect on recovery following adult-specific treatment, regarding what type of treatment you're getting. 2 injections, melarsoline, which was on the label for treating class 1 and class 2 dogs, kills 90% of the adult worms. The 3-dose protocol kills 99% of the adult worms. The 3-dose protocol, when we treat it, we're giving 1 injection. It's also called a split dose. We're giving 1 injection, which would kill approximately 30% of the females and about 85% of the males, for about a 50% reduction with 1 dose. And we come out with 2 doses to kill the other. Where with a 2 injection protocol, we killed 90% all at one time. And when melarsoline was introduced in the market back in the late 90s, we were using those 2-dose protocols very frequently and found that especially in the Southeast, where heartworms burdens are much higher, we were seeing lots of dogs have a reaction. So Heartworm Society quickly started recommending the 3-dose protocol in all dogs, because we can't predict how many worms are going to be in a given dog. Thromboembolisms from the dead worms occur whether a worm dies naturally or as a result of treatment. This occurs, if you're going to, as we said, the 5 to 7-year-old dog, the worm dies, we're going to get a thromboembolism. If we give melarsoline, we're going to have thromboembolism. If we do a slow kill protocol, we're going to have thromboembolisms. And depending on how active the dog is, it's going to depend what results we get from those thromboembolisms. So it's very important during a treatment phase that we exercise restrict our patients. Back in 2004, we started talking about doxycycline and found out that heartworms harbor a endosymbiotic bacteria of the genus Wolbachia. And this is a bacteria, rickettsial type bacteria that lives inside the worm, and it produces metabolites that cause a lot of inflammation. In fact, a lot of the inflammatory components from heartworms are a result of Wolbachia. And by administering doxycycline to heartworms, a positive dog, and eliminating the Wolbachia, when we kill the worm, we have found that we are able to reduce the inflammation significantly from these dead worm products. We also know from prednisone is the treatment of choice for the inflammation associated with pulmonary thromboembolisms. You'll hear some people talk about, well, steroids actually are, inhibit or actually cause coagulopathy, but the pulmonary thromboembolism we're talking about from heartworms is not from a clot. This is from a dead worm product and an inflammation issue. So we say prednisone is treatment of choice. Dr. Atwell years ago showed this to be effective. Of course, back then we were using the caparsolate, and we found prednisone would actually inhibit us from killing the worm. But Dr. Zemansky actually showed with melarsoline that there is no effect with prednisone. So prednisone is not going to decrease our kill rate with melarsoline, and it significantly cuts down on our inflammation. So here is a picture of the dogs. These are lungs. We're looking at a pulmonary artery. And this is a worm that basically died without adulticide treatment. And you were looking at all these, there on the kind of lower left corner are the adult worm. The smaller stuff you see there in the middle is actually part of the reproductive tract or the uterus of a female worm. That's basically its guts have spilled out. And so female worms are basically just big bags of uterus and microfilaria. But when you look at that, when that worm dies, this is what you're getting with these thromboembolic events. These things are causing inflammation because that dead product, that dead worm product, is causing the tissues to get inflamed, and then we get platelet aggregation, and then we can get some clots. But this is what the pathogenesis of when those worms die. Here's what a vessel, again, 15 days after a single dose of amiticide. And you're seeing the worm die, you're seeing it break up, you're seeing inflammation. And here again, 28 days after a single dose, again, worms are dying, cause of significant disease. And this disease that's going on, those thickening of the arterial wall, where it will resolve some, a lot of it's going to become permanent and may never completely go away. That's why it's so important that when we're treating these dogs, that we keep them exercise restricted to minimize the complications as much as possible. Here's looking at a pulmonary artery. It's opened up. It's kind of splayed open. You can see the inside. You can see the kind of reference appearance, but this is 12 months after 3 injections of adulticide. Here's another vessel. Look at one 12 years after an uncomplicated. This is a dog that went through treatment, no complications, but this is the scarring that's occurred in the lungs. And so again, this shows the importance that when we have heartworms, we may treat and clear the infection, but disease can be forever. And our important thing in a treatment is trying to minimize as much disease as we can. Again, another one 13 years after uncomplicated treatment, looking at, again, vessels, and actually sometimes with the mummified cuticle of a heartworm inside that vessel. And this is from using caparsolate, which we used way back in the 70s and 80s and into the 90s, but melarsoline essentially replaced it as our treatment. Heartworm Society recommends that we use doxycycline and a macrocyclolactone prior to 3-dose regimen. By using the doxycycline, what we're going to do is we're going to eliminate Wolbachia. We've had studies done that have shown that the most effective dose in reducing Wolbachia is going to be 10 milligrams per kilogram twice a day for approximately a month. Some dogs may have issues and not tolerate it well, which we can cut back to 5 milligrams. But we know that 10 milligrams is the dose that's going to get the most reduction of Wolbachia. We give them a 1-month rest period. And we have just recently completed a study that shows during that 1-month rest period, the worms actually do get smaller. So we have less biomass. And then we come back after that 1-month rest period, we give 1 injection where we're going to kill basically 50% of the worms. We're going to put the dog under rest, no running around. We're going to give it some prednisolone to reduce the inflammation. And then we'll come back a month later and give it 2 injections where we kill the remaining part of the worms. And we're going to kill 99% of the worms with minimal complications. Any method just utilizing a macrocyclolactone, which we call a slow kill, which was probably advocated years ago, just like maybe using an ivermectin base and only using that product, is not recommended. This is looking at some lungs, gross and also histopathology. And there on the left, this is what the lungs look like just with melarsoline, and you can see the histopathology, all the infiltrate there, and the histopathology slide below. And then there on the right, there's one that was basically treated with ivermectin, doxycycline, and melarsoline. And you can see how much less inflammation we have, how much less infiltrates we have. Again, what we're trying to do is kill most of the worms, which the 3 injection kills 99%, and reduce our treatment complication, reduce the pathologies occurring in the lungs. Here's a picture of a lung. This is a dog that was basically treated with a slow kill, just put onto a long-acting ivermectin product. And after 3 years, this is what we're seeing. There's a cuticle of a worm, and there's a lots of inflammation in those lungs. Seeing that these slow kill protocols are not safer, they're not soft kill, we are getting inflammation, we're getting disease, and later on in life, we will start issue with vascular resistance and maybe eventually heart failure. In cases where arsenical therapy is not possible, maybe it's the issues with liver or cannot tolerate the drug, it's contraindicated. Sometimes it may not be available. The use of a monthly oral ivermectin or oral moxidectin or topical or injectable moxidectin, along with doxycycline for a 4-week period might be considered. This is what we call, people now call them the moxie-doxy protocol. And it will eliminate worms, but it should be noted this is not recommended as a first-line treatment. The standard treatment should be, again, the gold standard if the client has the time and has the means, the ability to do this, because we know it's going to be the safest treatment. The safety and long-term effects of these protocols, of the slow kill protocols, moxie-doxy protocols, have not been fully evaluated, but still there are options that we can look at if we need to. Looking at there, we were talking about wanting to have minimal complications. There was one study, Dr. Amy, she's on our Heart Society board, where they used a moxie-doxy protocol. And these were client-owned dogs that were not exercise restricted, because it's kind of hard to keep a dog in a kennel for a year that's client-owned. And during that treatment, basically 36% of the dogs were having some coughing and respiratory complications. And this is about 1.5 times what is recorded just with melarsoline, and 6 times what's reported with the Heartworm Society recommended treatment protocol. So we do have some increased complications because, again, it's hard to keep a dog exercise restricted for upwards of a year. And another study of severely affected dogs with doxy and topical moxidectin, the radiographic evidence of the disease progressed at the same rate as untreated controls, and arterial thrombocyte scores were significantly higher. And these were dogs that were actually in kennels and not allowed to run around, because this was an experimental laboratory model that was looked at. In comparison, Laura Kramer years ago, with her looking at ivermectin, doxycycline, and melarsoline, and looking at those lungs, basically had a virtually absence of thrombi, again showing that having a shorter treatment protocol and using everything there where you can control it, we can reduce the amount of post-treatment complications. We have a lot now talking about spectrum of care. So what we're going to do is we're going to look at the different protocols that are out there. The 2-injection protocol, it kills 90% of the worms. We only get about 50% seroconvert. Length of treatment is about 1 month, but we're looking at respiratory complication rate probably around 20–22%. The 3-injection protocol kills 99% of the worms. Our post-treatment respiratory complication rate at 22%. Mortality was 5.2% of class 1 and 2s and 18.2% of class 3s. Length of treatment is about 2 months. And this is probably what back in the early 90s, which we were doing on these heartworm cases before we started including doxycycline. The Heartworm Society protocol kills 99% of all stages. Our post-treatment respiratory complication rate of 6.52% with mortality less than 0.1. So again, we cut down on the complication rate significantly. We decreased our mortality rate significantly. Our length of treatment is about 4 months. But as to today, this is the treatment that we know has the least complications and the highest efficacy rate ones that are out there. Our slow kill protocols. That's again, I talked about the Dr. Ames' study of moxidectin. Not exercise restricted, respiratory complication rate was about 36%. 96% severe converted to antigen. So it's a good high, efficacy rate. And it took about a year for these dogs to reach that area. Dr. Savadella's one that was done in a kennel. This was a kennel dog, so these were a terminal study. And 5 of the 8 dogs had no heartworms in 10 months. The ones that did have worms was only like 1 or 2 So it was a highly effective. We killed about 90% of the effective eliminating worms. We don't have a whole lot on these dogs about any type of post-treatment or complications because, again, they were in kennels, they were not running around. So that decreased the amount of issues that we have. As we say, exercise is the #1 factor in how it deals with post-treatment complications. This is one just recently came out, was just published this past month. And this was an Italian shelter study. These are dogs, again, kept in kennels. And they were looking at the 3 different types of moxidectin using topical, injectable, and oral. In that particular study, 80% of heartworm dogs were negative at 10 months with the topical, 70% with the injectable, and 50% with the oral. So we didn't have near the efficacy shown in this particular study. But again, these were ones also kept in kennel. Of the 30 dogs, so there was 10 dogs in each group, 4 of them showed an improvement of cardiac function of 13.3%, which means 87% didn't have any improvement in their cardiac function. Slow kill protocols may increase the chances of intracardiac heartworm. So intracardiac heartworms, which are the cable syndrome, occur when we have such an increased pulmonary vascular resistance that the worms actually are able to fall back into the heart. And at the most recent Heartworm Society meeting this last September, we had a cardiologist who is in the New Orleans area, and he reported to us that of the dogs, 1/3 of the dogs that referred to him for cable syndrome were undergoing slow kill heartworm treatment. So that's something we also have to be aware of. And again, if we're going to look at a slow kill protocol, we need to make sure those dogs are exercise restricted until we're cleared of heartworms, which sometimes can take upwards of a year. This is just, we're going to just real quick, just looking at cost comparison. This is just from my practice, just looking at the cost of drugs. This is not cost of administration. This is not hospitalization. This is just pure cost of what your products would cost. And at a 66-pound dog, the Heartworm Society protocol is comparable to what the moxidectin protocol would be in cost. The molarspines are less. A 20-kilogram or 44-pound dog, the price of molarspine protocols goes down, whereas the moxidectin protocol stays about the same because the topical moxidectin cost is about the same regardless of what size you get. And you get down to a 10-kilogram or 22-pound dog, it becomes even a bigger disparity in cost of product. When you look at our efficacy, the 2-dose, as we say, is 90%. The 3-dose molarspine is 99%. The Heartworm Society is 99%. And our topical, we had a 96, a 96, and 80% on that. If we look at respiratory complication rates, 2-dose molarspine was 22, as was 3-dose molarspine. Heartworm Society protocol was 6.52. The moxidectin protocol in dogs that were allowed to run around was 36. It was not reported in the Savidellis study. It was 20% in the Italian study. Again, showing our respiratory complication rates are less and our kill rate as high as with the Heartworm Society protocol. That protocol was basically, it came out from this particular paper here that was presented at the Heartworm Society partially in 2013. This is available if you go to heartwormsociety.org. You can pull up our guidelines and you can see the guidelines, but this is basically a chart and looking at that, laying it out of how that protocol goes. Basically, the dog is diagnosed with heartworms. You always want to verify the test. So if you have an antigen test, send it off and then either get a second one from a reference lab or do a microflare test, but you want to confirm for sure that it's heartworm positive before you start any type of treatment. We do recommend applying a topical product to repel mosquitoes or kill mosquitoes, because again, that's trying to prevent this dog being a reservoir of infection for other dogs. And also begin exercise restriction, because the more that pronounced the signs, the stricter the exercise restriction needs to be. If the dog is symptomatic, he's already coughing, having some issues, we need to stabilize it. We may give pred, we may give an allopril, but we need to get that dog stabilized as soon as possible. We also start a heartworm prevention. And when we say an appropriate heartworm prevention, we know that as far as if you're doing this protocol, that ivermectin and moxidectin are most effective. Ivermectin has been shown to, in conjunction with doxycycline, to decrease Wolbachia levels faster than doxycycline by itself. We don't have the same data of moxidectin, but we're pretty much sure it does the same way. If you have a lot of microfilaria, the dog probably should be administered antihistamine and maybe a steroid and watched, because when you have a lot of microfilaria, you may get a rapid die-off, and we don't have an anaphylactic reaction. It's usually on the first time. Secondary doses, third doses down the way, it's not going to be an issue. For the first month, we administer doxycycline 10 mg per kg twice a day for 4 weeks. If the dog does not tolerate this very well, we can reduce to 5. They also do better taking with food than doing it on an empty stomach. But again, that's going to limit Wolbachia and reduce the amount of metabolites that cause inflammation. It also is going to disrupt any heartworm transmission, because once we eliminate Wolbachia, we'll also eliminate from the microfilaria, and those microfilaria that are circulating with now devoid of Wolbachia, even if they're picked up by mosquito, will not develop to adult worms when transferred to another dog, because they need Wolbachia to complete their life cycle. Again, a month later, we get another preventive. Again, add more topical products to repel mosquitoes. And after our wait period, then we give our first injection of melarsoline. The dog should be exercise restricted, even more so. Basically kept, kennel or a small room, take out for a walk. Do not allow it to run around outside, because these are when the worms are dying. And those worms are going to break up. They're going to cause inflammation. And if they're running around with those vessels, then now we're going to start to be diseased and rupture. This is probably why we see less complications with this protocol than with a moxidectin protocol, is because we know when the worm's going to die after giving melarsoline. They're going to die in that month period. When we use a slow kill protocol or moxidectin protocol, we don't know the worms are going to die. And therefore, we don't know when the dog needs to be kept quiet. And again, like I said, it's very, very difficult to keep an animal restricted for an entire year. Second and third doses are day 90 and 91. 1 month later, we check for microfilaria, which probably 9 times out of 10 won't be there, because the doxycycline and macrolactone will eliminate them. And then at 9 months, we will give, after our last melarsoline, we will do a antigen test to see if we cleared. We used to say this was 6 months, but the tests are becoming more and more accurate and more sensitive. And so we were still seeing some dogs positive 6 months. And so we pushed this out to 9 months to be sure we've had time for all those worm products to clear from the body. These are a couple of cases that I want to show you here. So this is Dakota. This is one that I always say the middle-aged active dog. And it was presented to us for a second opinion because it had pretty severe heartworm disease, and the regular veterinarian gave a great prognosis, and it was brought to our practice. Weighed 61 pounds on 824. Basically, after trying to stabilize the dog, he started putting his weight back on fairly rapidly. But look at those lungs, and you can see heart's enlarged. You can see, look at the lung field, especially those caudal lung lobe, are severely inflamed, severely affected. And there with the Davy, you can look at there, especially on which is the left side of the chest, which is the right side of the film, that bigger consolidated area right there is the thromboembolism. So this dog, severe reverse D, increased pulmonary vascular resistance was causing that right side to bulge out. Pretty severe heartworm disease. This is a class 3 dog that we used to about 18% of these we would lose. This dog was started on doxycycline, and again, looking at this dog here was a month so later, and then here it's like 2 months later after we finished it, and we can see That right side is not near as ballooned out. We've decreased our vascular resistance. Our lungs are starting to improve. And we were able to treat this dog successfully. This is one I really like to show people, because this is what can happen with a young, active dog. So here's a 2-year-old blue heeler. And it was presented at our ER service because it's seen in our clinic, and they thought it basically had pneumonia and a strangulated gut. They also noted it had a 306 murmur, and with a lot of ascites and thoracic heartworms, radiorest consistent with heartworms. Dog had been on heartworm prevention since it was a puppy on an ivermectin base. Heartworm antigen was strong positive. Further questioning, they didn't start their heartworm prevention until the dog was 6 months old. So this dog was infected, more than likely infected, before it ever started heartworm prevention, because they didn't start it at 2 months, they started at 6 months. And after 18 months or a year and a half of HeartGuard, these worms are dying. Those worms are now in a very, very active that's trying to run around or causing increased pulmonary vascular resistance. That great 306 murmurs, because those worms will follow back on the tricuspid valve. It's leading towards what we call like an intracardiac worm. But again, this is what this dog looked like. Here again, you're looking at severe enlarged heart, very, very ugly looking lungs, lots of infiltrate. Again, look at those pulmonary arteries. You can see how thickened and tortuous, and they're basically embolisms that are occurring with it. Again, this dog was stabilized, it was managed because of the ascites in there from the right-sided heart failure. We did drain that abdomen. We started on enalapril, furosemide, doxycycline, prednisone. This was several years ago. Nowadays, we would add sildenafil for the pulmonary hypertension to allow those worms to move back up into the pulmonary artery. Oxygen, and we did drain the abdomen to get some of the fluid because it was causing as much pressure with the ability to breathe. Again, look at this dog here. You can see it as it progresses along, lungs are looking better. A couple months later, again, some improvement. And again, 3 months later, so much better. We still have some issues with those lungs, but the lungs are cleared up. The heart is not as big because of the increased pressures. I did see this dog more recently here, and there are basic calcification scarring in the lungs that are permanent. But again, this dog was able to be treated successfully using that protocol. But you can see how those lungs cleared up over time, much better, and we had a very good successful outcome in treating this patient. On the heartworm side, we get lots of questions about treatment, and these are frequently asked ones. We'll kind of go through them real quick. Sometimes we get asked if giving 1 dose of melarstine followed by 2 doses 1 month later is safer than just giving 2. Wouldn't giving 1 dose once a month for 3 months be even better? Answer is no. It does take 2 doses, or basically 5 milligrams per kilogram within that 24-hour period to get the kill rate that we need. We only gave 1 dose each time. We would only be significantly decreasing it from 50% to 25% down. We would never get our same kill rate by not giving 2 doses within that 24-hour period. Can I start doxycycline at the time I give melarstine instead of 2 months before? The Wolbachia organisms that live inside the heartworm will die once the worm dies, and they are not going to sit there and proliferate inside the lung tissue. So what we want to do is we want to kill the Wolbachia before we kill the worm. So no, you can't start at the same time. It's not going to do any good as far as what our goal is, eliminating Wolbachia. So it needs to be started ahead of time. We recommend the 2 months because we do know that we'll get a greater reduction of worm weight by having that extra month wait period. Do I have to wait a month between putting doxycycline and starting melarstine injections? There are a lot of people advocating not waiting a month and doing it ahead of time. And we're killing the worms. We're getting them out there. We don't really 100% know whether you'll have the same outcome as far as pathology, because we do know that 1 month wait period does result in a less worm weight. And we have less worm weight, less biomass. theoretically you should have less pathology. But again, that would need to be studied to know for sure. Can I use moxidectin, selamectin, or milbemycin instead of ivermectin in the pretreatment phase? Moxidectin has been used and tested, and so probably yes, you can. No studies have been done with selamectin or milbemycin. Milbemycin has literal effect on worms over 4 months of age, whereas ivermectin and moxidectin both do. So no, it is recommended in the pre-treatment phase to use either an ivermectin or moxidectin-based product. Can I use minocycline instead of doxycycline? So many years ago, when doxycycline was short supply, we did use minocycline. Minocycline will decrease Wolbachia. It does cause a little bit more GI issues, and it does not eliminate Wolbachia to the same level as doxycycline does, although it is a very, very effective one. So if you did not have doxycycline available, yes, you could use minocycline, but again, expect more GI issues than you would with doxy. If they could not tolerate either tetracycline, you could either go straight to your malarspy injections, or you could use rifampin because it will eliminate Wolbachia and without some of the side effects as doxy will have. But doxycycline, reduced dose of 5 mg along with food. Most dogs tolerate it quite well. Is 2 weeks of doxycycline just as good as 4 weeks? No. 4 weeks was chosen because that's what it takes to eliminate those rickettsial organisms, just like that's what it takes to eliminate, Ehrlichia, which is a rickettsial organism. You need to give it the full 4 weeks to try to reduce as much as possible. If they can only get 2 weeks before they start vomiting, you will have reduced numbers, and you will have made some benefit, but it's not as good as the 4-week dose. All right. Any questions? Those are my email addresses. Feel free to shoot me an email. I try to answer most of them whenever possible. I do quite a few a day. And again, thank you for your time.
Thank you very much, Dr. Nelson. I like listening to your talks as much as I hope everybody else will. I especially like those charts with the expense explanations and the differences between efficacy and complications between the different protocols. That was really nice. So next, we're going to welcome Paola Dominguez-Lopez. She's a certified veterinary technician who works at the University of Florida in Gainesville in the veterinary community outreach program. She has served on the board of the American Heartworm Society since 2021 and is helping us to develop this set of technician training videos. And so she is going to now talk to us about how she would communicate each of these points about canine heartworm treatment to clients. Welcome, Paola.
Thank you, Dr. Nelson. Thank you, Dr. Riso. Welcome, everyone. Today, we'll be discussing heartworm treatment client education from a veterinary technician's role. This is Bud. He was diagnosed with heartworm disease at a general practice that the rescue has partnered with. The rescue coordinator called to schedule Bud for his heartworm treatment injections. We received his medical records. Bud was antigen positive and microfilaria positive as well. Here is a video of microfilaria being present. You can see them wiggling around in there. Bud was prescribed doxycycline at the clinic, but only 15 capsules worth. Unsure of the situation, why only 15 capsules were dispensed. Maybe the clinic ran out of the medication or the rescue could only pay for 15 at a time. We asked the rescue coordinator if a prescription was scripted out for the rest of the doxycycline. She said that they had a stock of doxycycline at the rescue and they gave the dog the rest of the doxy course. it was explained to the rescue coordinator, because there is no record of the patient being prescribed the rest of the doxy by a veterinarian, we need to prescribe the dog a full course of doxycycline before beginning the melarsomin injections. Now, the rescue understands that it is imperative for them to have a medical record from a veterinarian for all treatments performed to any animal. Once Bud finishes his doxycycline course, 4 weeks must pass before we can schedule him to begin his melarsomin injection protocol. In the meantime, Bud must also receive a macrocyclic lactone preventative every 30 days. On day 60, Bud is receiving his first melarsomin injection. Then 30 days later, after his first injection, this would be day 90, the second injection would be administered, and 24 hours later, the third injection, which would be the final one. 9 months after the last melarsomin injection, an antigen test should be performed along with a microfilaria check as well. On the discharges, we will state a date of when Bud should be antigen tested again. This will be easy to follow for whoever adopts Bud in the future. Remember, as soon as your patient is diagnosed with heartworms, begin informing and preparing the client of the importance of exercise restriction for their pet. Exercise restriction should continue 6 to 8 weeks following the last injection. If the client expresses concerns of being able to properly care for their dog and keeping them calm, let them know that there are multiple ways of achieving the desired goal. From drugs to mental stimulation exercises that can keep the dog busy and mentally exhausted while on the exercise restriction. Go ahead and grab your veterinarian so they can discuss possible drugs to prescribe for the dog. And in the meantime, you can go and research resources or ideas to give to the client for keeping the dog mentally stimulated and avoid boredom. Here is the link to the American Heartworm Society for more information and resources for everyone. And please go ahead and scan this QR code now for a free membership to the American Heartworm Society while you are enrolled in a veterinary nursing program. Thank you for joining us.